Ladies and gentlemen, welcome back to Entrepreneur Middle East. We're here live at the World Health Expo, and with me is the one and only Dr. Aoun. He's the Group Chief Governance Officer here at American Hospital, and we're very warmly welcomed at your stand today. Thank you so much. Shukran. How are you?
I am good. How are you?
Doing very well. Thank you so much for this beautiful welcome, and we're very happy to be here.
Thank you for having me.
So obviously, I want to discuss with you today, where is American Hospital now? What sort of projects are you guys working on? And some updates. Give us all the latest scoop.
American Hospital today is where it's supposed to be, leading healthcare in the region, expanding, incorporating the latest technology, excellence in care, and continuing to grow.
Beautiful, beautiful. So tell me, obviously Dubai has a very strong vision. The UAE has a very strong vision when it comes to healthcare. How are you guys incorporating, all of your systems and visions within that bigger vision here in the UAE?
As a leader in the UAE and the whole region, it is really imperative to make sure whatever we do is aligned with the overall vision of the UAE. UAE has been a leader and continue to be in many sectors, in many fields. Healthcare is the area that...
the most important.
The most important, especially what we learned after the COVID pandemic. It is crucial to have a healthy healthcare system.
Of course.
And the American Hospital is doing whatever it takes to live up to that vision, and also making sure that we not only create, but also have everything in place to sustain that healthy system.
And I mean, you need to lead the trends, rather than follow them. And I think that's the most important thing. Now, tell me, is it difficult, is it challenging sometimes to balance out both international standards and local standards? Do they differ? Are they similar? Tell us a little bit about that.
Well, if it's too easy, it would be boring. We need that challenge.
Everybody needs a challenge.
Exactly. And the most important thing is, whatever we do in healthcare, to keep an eye on the most important target, which is the patient. And anytime we incorporate any guidelines, any standard, we want to make sure that they are culture sensitive, patient-centric, and specific to the region. So we want to implement the latest technologies, the latest standards, but also we have to make them a little bit of a GCC specs to fit the whole region.
Of course. And tell me, tech is obviously an important part. AI is a huge word these days. Are you guys incorporating all that? Because when I see AI being incorporated into tech now, imagine what it can do with healthcare. Imagine how many lives it can save. Tell me a little bit about the way AI and the latest technologies are incorporated in the systems within the hospitals.
We are incorporating AI in a cautiously and a conservative manner, because the utmost important is the patient safety. We don't want to rush to implementing AI without having solid evidence about the safety of any modality, but at the same time, we don't want to stay behind and not implement it in a timely fashion. So it's a fine balance between incorporating the latest technology and the wisdom with which we use it.
Of course, amazing. Now, since you are a doctor yourself, I have to ask you, please tell our audience, how important is it to actually take precaution before something, starts hurting in our life? Usually people don't do diagnostics, they don't check their blood until there's a kidney stone, and then they end up hospitalized. Why is it important for people to actually take precaution, do yearly testing, and take the car to the mechanic before the tire pops? Why is that important?
We have a saying here, and it might be international, an ounce of prevention is much better than a pound of cure. And that applies obviously to healthcare, preventative care, because it's much safer and easier to prevent and avoid dealing with downstream consequences if we can fix things upstream.
Would you advise it as a once-a-year checkup? Is that something that would be okay?
Absolutely, once a year, or as clinically needed and warranted by the patient's condition.
Right, amazing. So where can we see, the future of American Hospital going in the next couple of years? What are kind of like your visions, your goals this year? We are in Q1 now. You're, I guess, setting your vision straight.
We will continue to build on what we've achieved so far. A 30-year legacy cannot go but even higher and higher. And we will be differentiating into an academic health system. We have been a 10-year member of Mayo Clinic Care Network. In collaboration with Mayo Clinic, we are working on establishing a medical school to transform whatever we've done
Beautiful.
and take it a notch up and become an academic health system.
Amazing. And I wish you the best of luck, Dr. Paul.
you.
Thank you so much for this interview. And we wish you the best of luck on behalf of Entrepreneur Middle East and to many more interviews with you. Thank you. Shukran.
Pleasure. Thank you.